Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well. I wanted to educate and show you something that we use here in the background, a live blood analysis, which is just a subjective image of something that we do with patients every day. And you can see some of these live blood cells, red blood cells, and serum and that in the background. But let me share with you what's the point of this and why I'm doing this and what I want to teach you. So one of the things is, what is the #1 cause of death in America? Heart disease. It's still the #1 killer, okay? What is going to happen with everybody in aging? Everybody in aging is actually, unfortunately, if we're fortunate enough to live long enough, unfortunately, the likelihood of dementia and Alzheimer's and even Parkinson's now is on the rise, and you've heard me speak of this before. And also, what is another thing that's going to happen if we're lucky to live long enough is degenerative and loss of bone. So let me tell you a simple way and something that's very, very, very effective, but also something that I see every day with every single patient, okay? Even if you're very healthy, because we eat an American diet and often a processed diet, not a whole food diet, and eat too much gluten, too much dairy, too much sugar, okay? But there's something simply, and I'll tell you at the very end of this segment, what you can do, okay, that will actually help improve this and has many, many, many beneficial side effects. And you don't hear me say that very often or hear of something that's a side effect that's beneficial, but that is exactly what I just said. So how do you prevent heart disease? How do you prevent cognitive loss later on in life, decades later, dementia and degenerative changes of the brain? How do you prevent and improve your bone health? One thing, a good gut health. In fact, my experience with cardiovascular disease is it really, really, really boils down to, okay, and this is non-specific, okay, which in our office we get very specific and personalized on every level, which you all know this. When you run a functional personalized medical practice, we're very detailed. But this is non-specific, okay, but it involves everybody, okay? Is your gut creates the most inflammation in your body on a daily level than anything else. Every second, every minute of every day, everything you put in your mouth actually has an immune influence and an influence inflammatory-wise on your entire body, okay? So when you think of this and you think of then heart disease and that, which there's multitude of studies and a much evidence-based information now and data on, that inflammation is the root of heart disease, okay? So we want to make sure that we are in an anti-inflammatory and in a non-inflamed state. Also, the biggest immune system you have in your body is not your blood, not your lymph nodes, not your thymus, not your bone marrow, etc. It is your gut. It is your digestive lining. So this barrier on your digestive lining, these epithelial cells, okay, in your gut and in your digestive lining have these little villi and these tight junctions, okay? This is in your digestive system and in your gut, okay? These actually, this lining, this barrier, also has a mucinin lining over it, okay? And there's some things that support that, but basically it's like a snot. It's like a mucus, it's like a snot that actually is very protective to your gut, okay? You need this. It's basically a barrier. When that barrier is lost, actually, these cells, these epithelial cells and villi get damaged. And when they get damaged, you end up with something that is a permeable barrier. And then you can get inflammatory reactions in your serum, in your blood, and immune reaction, antibody reactions that happen very easily. And this can actually happen just from simply eating gluten, from eating too much sugar, too much processed foods, okay? Other things that can influence too are stress. Stress actually will limit the production of mucinin, and you actually will start to pull that snot and that mucus off your gut lining and actually can end up even in the toilet. So if you have been told you have IBS or you have bowel issues and you bloat and you have loose stools and diarrhea and often sometimes even get some mucus in your stool, that is mucinin. And that mucinin is your gut lining, and that's what's protecting you from inflammation every day, every second. That inflammation then can cause vascular disease and actually cause malabsorption and actually can cause a lot of inflammatory and immune process in your body. Okay, so you want to maintain a good gut health. okay, and a good gut barrier. And I'm going to tell you the one thing you can do that's additive and adjunctive to not just dietary things, okay, but when you limit inflammation, okay, in your blood, you limit these inflammatory negative cardiovascular, neurodegenerative, and bone effects, okay? What I wanted to show you here is on our live blood is this person I can actually tell has leaky gut and has this permeable barrier has been damaged, and they're getting actually microbes and getting part of their bacteria and fungal and biome, essentially this microbiome is leaking through. And what we'll see here is these little bits of actually what we call candida. And if you can see these little dot things, these are actually chylomicrons, which are part of cholesterol floating in the blood. And we do this test very, very often in almost every patient. And again, if I look around here, these are some oxidized red blood cells. These are actually red blood cells that we're seeing here. But what I wanted to really show you is these cloudy, clumpy things in here are actually something that's called candida or yeast. And that should remain in your gut and should not be in your bloodstream. This is 1 drop of blood on a patient, okay? It's completely from something that's called leaky gut, from this dysbiotic, permeable issue that's been damaged, barrier in the gut. And again, creates inflammation and immune reactions. So it can lead to risks of cardiovascular disease, okay, and been proven to be a risk inflammation, okay, just like sugar has to the brain, okay. And if you have this, you malabsorb, and malabsorption leads to low calcium, low vitamin D, low fat soluble vitamins, vitamin K, that actually support bone health. So one of the main simple things you want to do, okay, to prevent this, okay, and this has been proven and studied, okay, is you need to de-stress, okay? Meditation, yoga, things that are relaxing, that calm your immune and autonomic and adrenal response, okay, will actually help protect that mucin lining so that you don't lose that snot, if you will, that's protective to your gut, so that you don't get leaky gut, so that you don't get the candida. Okay, candida again is immune inflammation and that in your body. The other thing that you can do is stay and be gluten-free. Gluten actually aggravates American processed flours and gluten, aggravate and damage the mucin and the epithelial cells in your digestive lining, and then you get leaky gut. Okay, the other thing that you can do is stay off of processed foods and sugars, okay, and take a high-grade probiotic, multiple strain live good bacteria, so that you can build up this biome, these billions and billions, if not trillions, of good bacteria in your gut that help fend off this type of damage. And the third thing that I love to use is, as we age, we need an amino acid that's called glutamine, L-glutamine specifically. And I try to get my patients to use about 2,000 to 3,000 milligrams of L-glutamine, because it helps regenerate these epithelial cells. It helps these junctions here, okay, between the epithelium, okay, to become tight junctions again. They get regenerated. Luckily, this barrier in your gut is regeneratable, and it helps those junctions regenerate and become tighter, so that you don't leak, okay, and you don't create this inflammatory immune response that can lead to inflammation, which leads to cardiac disease, which leads to autoimmune disease, which leads to malabsorption. But it all stems down to your gut health, your gut lining, the type of diet, and the lifestyle you live, okay? So very key, very, very key to pay attention to this in your lifestyle, because these little steps that you take every year, every 5 years, every decade, can make a huge improvement over your longevity and your well-being. So hopefully this enlightens you, informs you, and educates you a bit. But also, let me tell you something. You can find these products that are, and I always would state this, get products, supplements that are certified GMP, good manufacturing processes, that are third-party tested. You can find these on our website, and it's linked to our warehouse called Carewell, and our passwords that you can order L-glutamine and a high-quality probiotic on there. The password is health, okay, which we always are striving for you to maintain good health. okay? And it's on our Longevity Health Institute Inc.com website, okay? But what's very key is that you get high-grade supplements. You want good L-glutamine, you want good probiotics that can actually help regenerate this barrier in your gut, get rid of leaky gut, get rid of this yeast, which is essentially getting rid of this inflammation. And then you can actually start having a more regenerative ability, okay, and start limiting this damage that we do with an American processed diet. So hope this informs you, hope it educates you. Share with others, share with loved ones and friends and family. You know, at Longevity Health Institute, we always give you and bring